welcome back to the Childhood Cancer Perspective, and thank you all so much for once again sticking with me as I continue to detail the journey of our daughter JC and her diagnosis with a rare form of brain cancer. One of the cool things that I've been able to do in the past year, aside from telling our story, is telling other stories and allowing them to share their personal connections and perspectives to pediatric cancer from the medical side, from the nonprofit side, but also from a parent side. So today I have a guest with me that is connected in all of those ways at one time, and I want to be able to allow her to share her story, her connection to pediatric cancer, as she has been affected in multiple ways. And so today, Dr. Ashleigh Kussman, I'm honored to have you on the podcast today. Go ahead and introduce yourself, and then we'll find out more about your story.
All right. Well, first of all, thank you for putting together this podcast. I didn't know it existed until I was informed by our media team. This is an awesome podcast. I think being able to relate to other people and their stories really allow an aspect of healing that's often undervalued or not recognized. And that's something that I've learned throughout my experience as a pediatric cancer survivor, a pediatric hem-onc physician, and pediatric cancer mom more recently. That stories are really invaluable in allowing us to heal and knowing that we're understood.
Absolutely.
So I am very thankful for you putting this together, and I will spread the word of your podcast.
I love it. Thank you very much.
I am a bit unusual in that I say I'm the pediatric cancer trifecta. I am a pediatric ALL survivor, which is a type of leukemia, diagnosed when I was 11. Never had pediatric cancer in my family, so I was the first. And that inspired me to go into medicine. So I set out to become a pediatric hem-onc physician. And during my training to become a pediatric hem-onc physician, my son was diagnosed with brain cancer. And so I have the unique perspective of being on all sides of the bed, so to speak. My diagnosis was shortly after I started 6th grade. I had previously been healthy up until that point. It was a few months prior to my diagnosis during the summer that I had started to lose weight. I had had a course of the chicken pox that was pretty severe. That took a month to overcome. And then following that, recurrent fevers and severe abdominal pain and respiratory tract infection that wasn't going away, which ultimately led to my diagnosis. It had taken a couple weeks prior to my mom taking me to my pediatrician to figure out what was wrong, which I think is a very common theme with pediatric cancers, given we all think that pediatric cancer is, quote, rare, even though it's the number one disease killer of children. Oftentimes we think the symptoms that a child has is something else, like something more common and maybe not as severe. You know, my mom herself had contributed my weight loss over the summer to me getting taller and thinner, entering my adolescent years. The 2 weeks leading up to my diagnosis, my pediatrician thought maybe I had pneumonia that just wasn't showing up on the chest x-ray yet. He had taken blood from all of my fingers except for these 3 on his, office machine one day. And they kept saying, oh, like there's something wrong with the machine. Your blood wasn't reading. We're going to have to take blood again. And it didn't trigger like, hey, maybe it's because your blood counts are out of parameter. So ultimately, after about 2 weeks of going back and forth between urgent care and the pediatrician and getting chest x-rays, they sent us to Dayton Children's, and that led to my diagnosis of pediatric high-risk B-cell acute lymphoblastic leukemia. My trek with my cancer was about 2.5 years, which is typical for BALL. I had some complications. I was a slow early responder to the chemotherapy. So in addition to chemotherapy, I had brain radiation. We don't do that as commonly now, as we've learned that injecting chemotherapy into the spinal fluid is typically enough. But back then it was something that was commonly done to try to increase the survival for children who had pediatric ALL and high-risk ALL and ALL that wasn't responding well because leukemia likes to go to the central nervous system. During my treatment with cancer was really the first time I ever thought about a career in medicine. I had no relatives in medicine at that time. My mom and dad were blue collar workers and had not gone to college before. I was always that very good student, though, in school and wanted to know everything and asked all of the questions. And it was really two people that inspired me to consider a career in medicine when I was going through my treatment. One was the first person who made me realize that healing is more than just a physical phenomenon. It includes an emotional and mental aspect as well. And it was my nurse, Heather. I had been hospitalized for a complication from chemotherapy. And at that point, I was just very frustrated with everything that I was going through. I was 11 years old. I had just started sixth grade about a month prior to my diagnosis. And I felt like my life was on hold while the rest of my peers were moving forward. They were all going to school. They were all learning. That's what I wanted to do. They were going to Pee Wee cheer practice. I was a Pee Wee cheerleader at the time. And I just felt very isolated from my peers. And I felt like I was that one girl with cancer and nobody really understood what I was going through and how I felt. Very well-meaning people and loving people surrounded me, but I just felt like I wasn't understood in how I was feeling and didn't really feel like I could convey that to many people. And my nurse, Heather, I think had somehow sensed that, which I think if you've been through pediatric cancer, whether as a patient or a parent, sometimes you just get a sense as to when you should share something with someone. And I think she recognized somehow how I was feeling. And she then shared her story of having had cancer when she was a child. And she pulled out pictures from her pocket of her just prior to her diagnosis and showing where her tumor was. And then subsequently showed me pictures of her when she lost her hair and her going through her battle. And that was the first time that I recognized that there is healing and feeling understood. That was invaluable. So she is one person who inspired me to go into medicine, as I felt like I wanted to give that back, that aspect of healing back to other people. And she showed me that that was possible. The second person who's instrumental in me going into the career of medicine is my pediatric oncologist. He was really great at embracing my questions. I was always that why who wanted to know everything. And at that time, we had just gotten AOL. Now I'm dating myself, the internet, AOL, America Online. And so I would go home and I would research everything I could about my pediatric cancer and come up with a list of questions. And I would look up about my friends' cancers that I met on the unit and also ask questions about, like, what's different? Like, what is this type of cancer? What is this type of cancer? And where does this cancer come from? And my pediatric oncologist really embraced my questions and would be like, all right, all right, Miss Kussman, what questions do you have for me today? And I remember him getting out a book and showing me what hematopoiesis is, which is the process by which blood cells are made in the bone marrow, and showing me in terms that I could understand where my blood cell went wrong and developed my leukemia. So he really inspired me to go into medicine as well. And so I was grateful for that. So that's kind of how my story began as a pediatric cancer fighter. I finished chemotherapy in 8th grade and went on go through high school and successfully completed high school and did very well. I went to the University of Dayton for my undergraduate degree and I got my Bachelor of Chemical Engineering as a backup plan in case something should happen. I couldn't go to medical school right away. Life had taught me that you should expect the unexpected and prepare accordingly. And I was counseled that that was a good backup plan if for some reason I couldn't get into medical school right away. Subsequently went on after my achieving my Bachelor of Chemical Engineering degree to medical school and had done well throughout medical school, had taken a year to focus on pathology. They had an opportunity to do a preclinical pathology year. Pathologists are the doctors who look at cells under the microscope and can tell normal versus abnormal. And I thought that'd be invaluable for me in my career choice, since I knew I wanted to be a pediatric hematologist oncologist. So I did that as a break between second and third years of medical school. And I returned to my third year rotations. And shortly after starting my neurology rotation, out of all rotations, I developed the first side effect of a long-term side effect from the treatment that I received. Developed this awful pressure tingling in my head, trouble following what I was reading, trouble with word finding, and felt incredibly dizzy. I had gone to the family physician at the med school to try to figure out what was wrong secretly, because the joke is with medical students, if you've ever talked to someone going through medical school, is whatever rotation you're on, you develop the symptoms of that rotation. And so the joke is that you kind of become a little bit of a hypochondriac. And so I didn't want anybody to be biased in thinking that I was thinking I had neurologic symptoms on the neurology rotation out of all rotations. He couldn't figure it out. My blood work was fine. He even tested me for Lyme disease. That was negative. And it was actually a neurosurgeon that was on rotation with, as we had to do a day in the neurosurgery outpatient clinic as part of the neurology rotation, who noticed that I was, what I thought, discreetly leaning up against the wall in various rooms because I felt dizzy, but apparently I wasn't as discreet as I thought I was. He pulled me aside and asked me if I felt okay and if something had been going on, or did I have a rough night the night before. And so I explained to him what had been going on the previous 2 weeks, how I had this awful pressure tingling in my head. I felt increasingly dizzy. I had trouble holding on to the words that I would read in a chart and trouble with word finding. And he said he would do a neurologic exam on me in between patients. He did, and I had no neurologic deficits on my exam. And so he thought that maybe I had some weird migraine syndrome. And so he sent me to the migraine neurologist at our med school. And she subsequently diagnosed me with a condition called postural orthostatic tachycardia syndrome, which is fancy language for your body doesn't regulate your blood pressure and your heart rate well. And so that can make you feel kind of dizzy. I didn't quite fit all of the criteria of that diagnosis, but some of my heart rate changes could have. And so she put me on medication over that weekend. I felt progressively worse, came as a med student the next day and asked her in clinic. She wasn't my precepting attending, but I begged her for head imaging. She, I think, thought I was kind of crazy, the hypochondriac medical student. She had said, well, I don't think there'll be anything wrong. Your neurologic exam is normal. I was like, and she's like, well, why do you want a scan of your head? I'm like, there's something wrong with my head. Long story short, she agreed to a brain MRI, which I had. And then later in the day, she called me and let me know that it looked like I had radiation-induced leaky blood vessel tumors in my brain. They're called radiation-induced cavernous angiomas. And one of them in my left frontal lobe, which is the part of your brain that is responsible for thinking and language. The biggest one was in my left frontal lobe, and it looked like it had recently bled. And there's some inflammation around it. And so that explained my symptoms. And at that point, I was a bit shocked. When you go through cancer and you survive it, you're given a binder that includes a long list of possible side effects that you might endure from the treatments, the very treatments that saved your life. And radiation-induced cavernous angiomas, which was this leaky abnormal blood vessel tumor, was not listed in my binder. And so I had not had an opportunity to mentally prepare for that diagnosis. I had reached out to my pediatric oncologist, and he also hadn't had a patient yet with that side effect. I subsequently searched the literature as a medical student and found that it was first reported in 1997 in a case report out of Germany. So that was the first time somebody recognized that radiation can cause bleeds in the brain and abnormal blood vessel tumors. So now we do know now that radiation can cause both, quote, benign tumors, which are not really benign because they cause medical consequences, and malignant, meaning cancerous. So again, I found myself having to take some time from medical school and was again in this flashback situation that I was in 6th grade, where I felt like my life again was on hold while the rest of my peers were moving forward, which I think is a common theme for pediatric cancer fighters and their parents. Your life kind of gets halted when you get these diagnoses, including side effects. I had pushed through some softer rotations while dealing with the inflammation in my brain from that first bleed, and then went back to a family medicine rotation after about a month and a half from that first bleed. And I was again trying to read a chart, and all of a sudden I had that awful pressure tingling again in my head and couldn't hold on to what I had just read regarding this patient's vaccination schedule and what they needed. And I called my neurologist at that point to tell her, I think it bled again. And she had told me, oh, well, there's only a 15% chance that it'll bleed again. Are you sure? And I said, well, I'm feeling the same way I was before. Long story short, there, had the imaging and showed that it had bled again. So with it having bled twice in a matter of 3 months, it was recommended that I undergo brain surgery to remove that radiation-induced tumor. And I was told if it continued to bleed, I was at risk of developing a seizure disorder because blood is very irritating to the brain. And so here I was as a medical student trying to search who I wanted to operate on my brain, the most important part of my body that would allow me to function to be a physician in the future. That was quite nerve-wracking. I underwent brain surgery November 30th of that year, 2012. It was crazy driven and came back to rotations just 6 weeks later. Pushed through a few more rotations. Noticed I was still having some issues with word finding. And then I underwent some neuropsych testing, which showed I needed some speech rehab and some occupational rehab. So I ended up taking a few months off of medical school and went through brain rehab and then went back to medical school and completed medical school. So that was kind of my journey as a survivor. At that time, I had also, felt alone in what I was going through, and I had searched for pediatric cancer support groups, like survivor support groups, and I couldn't find any pediatric cancer support groups online, even on social media. All of them were primarily focused on adult cancer support groups. And I ended up finding a group that was made by a woman for her childhood cancer camp friends. And I had requested to join that group just because I wanted to connect with someone to see, if they had also experienced long-term side effects and how they were dealing with those as an adult. And had been accepted to the group, but was able to reach someone from that group. Her name was Rachel. And she responded, and she was a Hodgkin's lymphoma survivor. And she had also had multiple side effects from treatment. She was treated in the late 80s, early 90s. And she was the first person, again, as an adult, that made me feel like I wasn't alone. You never want anybody to have to go through any suffering. All of us who go through suffering, whether it be from childhood cancer or some other grave illness or tragedy, none of us want anybody else to have to experience what we endure. But having someone who can understand what you're going through in some capacity and validate your feelings of isolation and sadness and the grief that you experience, the frustration, the disappointment, even the anger at times of what you have to go through is invaluable. And so I learned that lesson first from my nurse, Heather, and I learned it again as a survivor and speaking with my survivor friend, Rachel. My son being diagnosed when I was in fellowship, I again learned that lesson. It's invaluable to connect with other people, other parents going through it. Even if your story is not the same, you understand how it feels to have your life kind of turned upside down and to feel like your life is on pause while everybody else is moving forward. And then as a parent, you have the additional stressors of, what am I going to do financially? Like somebody has to take care of my child. And then if you have additional children at home, how am I going to juggle between, my sick child and the healthy children. And that's something I had recognized with my own parents since I was old enough when I was diagnosed to see their struggles between, who's going to be with me at the hospital and who was going to be with my sisters. But again, seeing that as a parent, Thomas was my only child at the time, but talking with other parents and they had multiple kids at home, again, I recognized just how hard it is to be in this situation. And it affects the entire family. Pediatric cancer is not just a one patient illness. It's affects everyone. So it's given me invaluable perspective from that standpoint. I think as far as having that insight as a patient and parent, and then being a physician, I have been slow to judge parents if they seem very frustrated or short in our encounters, because I saw how stressful it was for my parents when I was going through cancer personally, then having been through it myself as a parent. And so I know there's a lot going on, and it's not about, it's not about me. Like if they're frustrated or they're stressed, they have a lot going on trying to figure out financially how they're going to afford all these medical bills. How are they going to afford everything else with their other kids when they're off work? Who's going to juggle what? And not just like medical appointments, but therapy appointments. And, so there's a lot going on. So I think I'm very slow to label a parent as angry or frustrated or a difficult parent, because I recognize that there's a lot going on in the background and we only see like a small piece of that as physicians. And there's a lot more that we likely don't know. As far as interacting with patients and their families, I don't always tell my patients and their families that I'm a pediatric cancer survivor. And I don't know how to describe when I feel like it's the right thing to disclose. It just kind of seems natural. I think it's probably similar to how my nurse Heather felt whenever she decided to share her story with me. She obviously didn't know what I was feeling on the inside, but she somehow had a sense. And so it kind of comes up sometimes naturally in conversation. And it can be like little things, like a parent, disclosing how hard it is to see their child struggle to eat when prior to chemotherapy, they ate everything. And I'm able to say, like, yes, it's so hard to see your child change like that. My son also was that way when he went through chemo. So my son had brain cancer, and prior to his diagnosis, he ate everything. And so it was so difficult to see what, him seem like he was wasting away in front of us, and us begging him to eat and him not being able to eat or have any interest. And so it's valuable in that sense, in that they recognize that I understand like how emotionally hard it is to, see what your child is going through. It's not just the physical hardness of having to be away from your other kids and having to be away from work and, the side effects, but like emotionally it takes a toll on seeing that. And then being able to share perspective when they ask about, for example, a feeding tube, like a tube that goes from the nose down to the stomach, and asking like, well, did you do that for your kid and how did they tolerate it? And being able to share, yes, like when we finally pulled the trigger to put down that tube, it was very helpful, and we no longer had to fight with him to give him his medicines. He could just play and didn't recognize when we were putting down the medicine and flushing, and it seemed less traumatic for him because we didn't have to try to pin him down or force him to give his medications. And we could also have confidence that he was getting nutrition when he didn't feel like eating, or hydration when he didn't feel like eating. And with my adolescent patients, for example, one patient, her dad was trying to break the sadness, I think, with humor. And I think this comes into the other lesson of how people cope in different ways. Her dad was making a joke about her being bald and calling her Baldilocks. And she did not appreciate that. And I was coming into the room when he was making such a joke. And I said, hey, like that is not funny. And let me tell you why. And she's like, yeah, that's not funny, Dad. And I had shared, my dad had also tried to break the sadness of pediatric cancer by making jokes, and his joke was that I looked like Tweety Bird when I was going through cancer with my steroids and my bald head. And although he thought that was hilarious and he thought that might make me laugh, that I looked like a Looney Tunes character, I did not find that at all funny as an adolescent girl who had lost her hair and wanted to look like everybody else and didn't want to be that one girl with cancer that, stuck out in a crowd. So we ended up kind of discussing how it was to be an adolescent going through cancer and how hard that is. That's a time in your life where you want to fit in. And when you're diagnosed with cancer at that time, you really stand out. So she ended up going through treatment, and later her parents shared with me that she wanted to go into nursing because she wanted to do something medical because of the impact that I made in her life and how that really helped her. One of my patients who I didn't disclose my personal connection to cancer, and this was before my son was diagnosed, she later found out that I was a pediatric cancer survivor when my son was diagnosed because she worked in the vicinity and had heard, one of the pediatric hemonc fellows who had cancer herself, her son was diagnosed with brain cancer. And she thought, well, who is that? And then she learned it was me. And she had tracked me down when my son was in the hospital and was like, why didn't you ever share with me, that you had gone through pediatric cancer? That would have really helped me. And I said, well, I didn't want to make your child's story and what they were going through and their trauma about me, because it's not about me. I was her physician. I never wanted to just bring up out of the blue that I had gone through this, because you want to center your focus on the patient and what they're going through and never make it about you. But later I found out she would have rather have known. So I guess sometimes you don't know when you should share or not, but I never want to make it about what I've been through, but sharing when I feel like it would be helpful. I know I've talked a lot. I guess the one other big lesson I have learned about through my experiences with pediatric cancer is that people cope differently, and very well-meaning people will say things that they think are helpful. And in fact, they can actually be very hurtful. I think one of those things is saying, stay positive, or look on the bright side, focus on the positive things. And people say that and they mean well. They really just want to try to make you feel better. But people who have not been on this opposite side of the bed don't realize that when you say those sorts of things, it can invalidate how someone's feeling. Going through pediatric cancer is very hard, and it's heartbreaking to get that diagnosis. It's a life-threatening diagnosis. What you had envisioned for your future or your child's future all of a sudden seems blurry, and then you hear about these treatments that you have to use. So not only can cancer kill you or your child, but the treatments themselves are life-threatening and can cause long-term side effects. And, so there is an aspect of extreme sadness and anger that you have to go through this, and why is this happening, and disappointment and frustration when side effects happen, and all, and even maybe jealousy that you see everybody else's life moving forward and yours is on hold. All of those feelings, whatever a person feels going through these hard tragedies, is valid, because if you feel it, it's valid. You have those feelings for a reason, and this is hard. And that's what I always try to tell my patients and their families, because when somebody says, stay positive or look on the bright side of things, look at all these things going well, it then makes the person who is having all of these other feelings feel like they shouldn't feel that way. And that can be harmful, because then it instills this guilt, well, maybe I am not a great person, and that I'm feeling this sadness or disappointment or anger or frustration. And I'm being told I shouldn't feel this way. I should feel happy because of these other things that are going well. And so that's something I didn't really recognize until I was an adult. going through survivorship long-term side effects, that I recognize it's very important to allow people to feel whatever they feel and again validate how they're feeling, because you have to work through those emotions. And validation how you are feeling also allows healing, to know that somebody else recognizes that you feel that way. And I recognized as a pediatric cancer survivor dealing with the bleeds in my brain, I went back and I relived all of those feelings I had as a kid, with the disappointment that I couldn't go to school, and the feeling sad that, I had to go through this, and the anger and the frustration and the jealousy that here I am, my life on hold and everybody else is moving forward. And I had felt like at that time as a kid that I had to put on a smile, kind of fake it, because I didn't want to make my family sad. And because so many people had told me at that time, stay positive, look at all the things that are going well, which, it can be a helpful coping mechanism to some extent, but you also have to recognize that those other feelings that you have and these hardships are valid. And so I really allowed myself, as an adult in medical school, again, having my life on hold, these brain bleeds from the radiation induced tumors, that I needed to process all of those emotions. So I let myself actually cry through all those emotions and recollection, and cry through what I was going through then, and feel the frustration of what I had gone through back then and what I had subsequently had to go through, in medical school as a survivor. And again, my life being on hold and on a different track from somebody else. So I always make a point to tell people, you feel what you feel, and it is valid, whatever feelings you have. And crying is not a weakness. Crying is strength, because if you can allow yourself to feel this whole spectrum of intense emotions, that takes strength. It takes strength to be able to live with those intense emotions and to really feel them. And so you have permission to cry. And if you feel like crying, like cry. If you feel like screaming somewhere, like go somewhere and scream, like your feelings that you're feeling are valid. And that's part of healing, is to be able to recognize all the trauma that you're going through and how hard it is, and to move through all of those and feel all of those and process all those. And that's part of healing. And as far as coping goes, again, there's no one right way to cope with these hard things. Where some people want to know all the things so they can mentally prepare for what might happen. Other kids or parents will say, like, I don't want to know, just tell me as, things come along what I need to know, because they know for their own mental health that if they're told, ahead of time, that it'll be very anxiety provoking and stressful for them. And so really, you have to tailor, to each person. Like if a parent wants to know statistics, like some do, others would rather not know. And so I'm always very cognizant too about those conversations. Like, is that something you truly want to know? Because I'm always going to be honest with you about, whatever you want to know, because this is your child. You have every right to know whatever it is about your child. And so I will never hold anything back that you ask. And some people who go through pediatric cancer, whether it be as a patient or a parent, once you're maybe through that initial fight, never want to have anything to do with the medical field because it's too traumatizing. And so, they run away from hospitals as fast as they can. They only go, to hospitals when they absolutely have to. And that's perfectly okay. Like, you don't have to go into medicine because of what you've been through. Whereas other people help with fundraising, or like what you're doing, like a podcast to allow people to connect with each other, or fundraising for pediatric cancer research, or fundraising to help families who are going through financial hardship. Whereas other, people are drawn to the medical field. I think in whatever way you cope with tragedy or pediatric cancer, I think it's a natural human response to want to help in some way. And there are various different ways that looks like. And I think part of healing from this trauma is trying to make things better for other people who have to go through it. I think it's a natural human response when you've gone through suffering yourself to want to do something to make it better for someone else that has to go through it. And so there are many different ways that looks like, and that's part of healing and coping. Additionally, I've learned from the medical perspective as a physician, when it comes to being diagnosed with cancer or your child being diagnosed with cancer, there are different ways that people need to cope. And there's not one size fits all. Something I recognized when my son was diagnosed with pediatric cancer was I had been told in my previous 2.5 years of training to always counsel parents that they need to take breaks from the hospital and they need to take turns, caring for their child, to have their own self-care. And I recognized when my son was diagnosed with brain cancer that my mental health was best when I was at my peak. Whenever I would try to leave the room, even for a cup of coffee, he would get very upset and cry. And that stressed me out. And I also felt more at ease and more calm when I was at his side and I knew what was going on. Whereas my husband was the opposite. My husband, not being a medical person and really needing to process things externally away from certain settings, he needed to go home at times to check the mail, mow the lawn, get away from the hospital. And that was how he coped. Many times my very well-meaning colleagues would say to me, oh, like, why don't you take a break and go home? Like, you should take a break and go home and like get out of here. And I thought to myself, what they don't realize is my home is not where my house is. My home is where my family is. And my family right now is in the hospital. And, that was easier for me to say because I didn't have any other children at home. It's different for, parents who have multiple children and they need to go home and spend time with their other kids. But for me, it provided more calmness to be at the hospital with my son so I didn't miss anything. And I also knew that he had the peace that I was there because I knew that he would get stressed out when I left. So again, there's no one size fits all for any of this. I think the other last point I'd say that I've learned through being on all sides of the bed is pediatric cancer affects people in many ways, and it doesn't end with the diagnosis and the primary fight. Something that many people outside of the childhood cancer community don't recognize. They think, oh, like you're through treatment, you're good now, right? Like it's all great. But most pediatric cancer survivors have long-term side effects. 95% of pediatric cancer survivors will have a long-term side effect by their middle age, and many of them serious and life-threatening. And we carry on the healthcare burden that our age-matched peers who have not gone through pediatric cancer don't. We have earlier onset cardiovascular disease, so more likely to have heart attacks at earlier ages. We're more likely to have strokes and dementia and secondary cancers from the very treatment that cured us. So again, I've recognized as a survivor and someone who has dealt with a long-term side effect that we really need more awareness. We need more funding, not just so we have more effective treatments. We need more effective and targeted treatments so more kids survive, and also so they survive with a higher quality of life. So we have a lot of work to do. We've made a lot of great progress, but we need more people to be enthused about donating to pediatric cancer research and making it a priority, and getting people, very smart people, excited about doing something more to figure out what drives these terrible diseases, how we can treat them effectively and target them so more kids survive and survive with a higher quality of life.
Yeah, I 100% agree with every single thing. And I tried to take notes and kind of go back on it. But what I think a lot of people don't understand on the outside of this community is that childhood cancer is largely misunderstood and we don't really understand what causes it. To have a liver cancer, but you're 5 years old, so obviously you're not drinking. To have, brain cancer, which is the number one, okay, it's the number one killer Okay. But yet it gets the least amount of that tiny little percentage of funding that we get from the government. That's what took our daughter. And nobody understands why it happens. There were 2 different types of tests, 2 different types of mutations she should have had to make her more susceptible to that cancer, negative for both. So we don't understand it, and we need more people looking in. And to be honest with you, I'll start off by saying that one of my biggest goals right now is working within our system here in Wisconsin, within the UW system, to create something that will allow all of those really smart, eager students to come in and want to find that next big thing. Yes, we want to study all of these pediatric cancers, but I want that one that wants to study the rarest one. That's like, this one's sitting on a shelf with dust on it. I want to figure it out. I'm hoping that that's what happens, and we keep pushing forward. And we work hard here to raise money and donate it to research and donate it to therapies, because the other side of that is that adult drugs in a smaller bottle doesn't mean it's a kid's drug.
Mhm.
When somebody made an analogy this a long time ago, is that if you go to Walmart or Walgreens and you want to get something for your kid, there is a pediatric aisle of things that are made specifically for kids. Why are cancer treatments not the same way? What if obviously you've been through it, you've felt it, but you've also seen it, what these drugs do to these children and what they put them through, and the images that we can't share because, God forbid, they are horrible and horrific. But what's so amazing to me, and with my daughter and these kids, the way that they can go through it with a smile on their face and an innocence, and care about everybody else and not so much about their own, what they're going through, is incredible. And that's the genuine hearts and love that we need in this world right now, is what these kids go through. Another thing that you had brought up is kind of what to say and what not to say to parents. And I know that when our daughter was diagnosed, we were alone on an island. We didn't have anybody in that community. We didn't know anybody in that community. I'm guilty of it, growing up watching the commercials and thinking, that's horrible. How do you even deal with that? How could, and then you become that patient, that parent. And now when people reach out to me, or if we're talking to them through social media and stuff like that, I will say, literally, I have 0 words that are going to make this feel better. Nothing is going to make it feel better, but I'm here for you if you need something, if you want to vent, if you want to yell, it's okay. But nothing I say, be strong, stay strong, be positive, look at the bright side. There's not. To be honest with you, if I had to find a silver lining, it's that I got to spend a lot of time with my daughter when she was home from school and stuff. If you're looking for a bright side, there it is. And you're stuck in the hospital for a long time, so you find ways to make it fun. Child life. I love all of you. You guys are incredible, and they should be paid more, by the way, if anybody's listening. But but
Agreed.
but
Our
they're
nurses too.
up. Oh my goodness.
Everybody. Yeah.
Yes, please. It's something when and believe me, it is a special type of person to work with children every day, because to be able to come in and not detach yourself from it, but to be able to do it and not break down every single time you're in another room going through it. But the real people are the ones that do walk out of the room and break down because of what they're seeing. I say that our social worker that we were working with, the day that we were told it's relapsed, it's coming back, she couldn't speak to me physically. And this was during COVID times. I didn't know what anybody's faces looked like from the nose down for 2 years. And she physically was breaking down and could not speak to me at that moment. That's how much they cared. And that's the ones you want working with you. Pick your team. That's the ones you want in those rooms. And those are truly amazing people.
I love that you said that. And thank you for saying that, because I think that's something I've noticed in the medical community and with my medical training, is that oftentimes we are told that we shouldn't show any emotion and that we need to, quote, stay strong for patients and their families. But I also have to say, as a patient myself and as a parent, that I felt like I was cared for and that my son was cared for more. And I felt more confidence in the team when they had shared emotion, because I felt like they were invested. So, like, when my son went to the ICU with septic shock and almost died, that that nurse who was on overnight, when I was concerned about him being in septic shock, I went back the next morning to our room to get things from our room, and we ran into her, and she was, when she saw us, she just broke down in tears, and she asked if he was okay, and she was so worried about him, and like we hugged, and I felt like we were in good hands because I could tell even when he was sick at night that she was concerned. And, she apologized for crying. And I said, "You don't ever have to apologize for crying." I said, "The fact that you are crying shows me that you care." That like made me feel, even when I saw it in your eyes when he was sick, that you were going to be looking out for him. And that provides a sense of comfort and also healing, and knowing that somebody cares about your child. And one of the charge nurses, who had overheard our conversation, had said, "Can you please like voice that louder so that everybody can hear? Because we're told not to show emotion." And I had even shared, one of my attendings in training had said, "Don't ever cry in front of patients and their families. If you need to cry, go into the stairwell and cry," is what she told us. And as a patient, I hadn't become a parent at that point, but as a patient with, what my nurse had gone through and shared with me, I felt like that was not the right message, at least not from my perspective and what I had been through. I mean, certainly we want them to keep themselves together enough to where they're still able to care for our kids. Obviously, if they're totally emotionally distraught, it's going to be hard to maintain perspective and continue on with what needs to happen. But, seeing some emotion from those who care for us and care for our kids, I feel like instills confidence. It sounds like maybe that's what you've experienced too.
It shows a human side, and it shows that you're not just there, and your child is not just a number. That
Exactly.
you walk in the room, and they know their name, and they know what they like, and they talk to them like like an adult, to be honest with you, because even as with our daughter at 6, 7, and 8 years old, they deserve the respect of what they're going through, and to talk to them like an adult, ask them how they're feeling versus going just directly through the parent. Getting that input for them is huge. And to be honest with you, as you were speaking, I was thinking back that there were only two people that going through her treatment that I did not allow to come back and be part of her care team ever again. And it was because of bad attitudes. The thing is that you can have a bad day, and every job you're going to have a bad day, and it doesn't matter if you're working with kids or you're a pilot, you're going to have bad days, but you have to learn how to leave that at the door and just do what you signed up to do. And there were only two, and that was the only reason. I said, she's already scared. She's already up, going through all of this. We don't need that type of energy in here. And that was it. Otherwise, her care team was amazing. And I still, to this day, have connection with her oncologist. I still reach out to her, and we talk, and I bounce ideas off of her. She's amazing. And it's, one day I hope to have her on here as well to tell, a little bit more about her connection to it. But, we were lucky enough to find the one person in our area that had treated our daughter's type of cancer, and she pulled her name out of the file and said, "I'm going to take over this care." And it was great. And in the end, we obviously we weren't able to save her, but what we advocate now is not for JC. We advocate for all of these kids that are going through it. We advocate for all the kids that will be diagnosed every single year. We look at it saying that rare word is something that will cause me to really say a lot of swear words when people say that, because it's not rare. And the reality of it is, when our daughter was diagnosed in 2020, the number was 43. Now it's 47 a day. So it's getting worse, and continuing to put out percentages and numbers that show, well, we have a cure rate of this amount, but there's hidden meanings behind all of those numbers. The statistical stuff, I like it, but I don't, because 4% or 8%, and we're excited about all this funding, but it's not enough. It's the parents, it's the advocates, it's the doctors that are connecting with these children, that are carrying the load of trying to get funding and research and awareness, when it shouldn't be that way. These are our kids, our most precious asset in this world, and we should be treating them like that. I mean, there's a reason that gold is the color for children, but there's also a reason that nobody knows that September is Childhood Cancer Awareness Month, and we will know what month is next month, and we'll be just kind of overshadowed. And I hate that, because it's not about taking away, the coverage from anybody else, or taking away that awareness, but where is it for us? We're over here doing the best that we can, and we have to create podcasts or nonprofit organizations, or we have to go knocking on the halls of DC or our own capitals it should just be a thing that happens, like a knee jerk. We should take care of our kids. I don't understand, I guess, why that's such a hard concept sometimes for people to understand.
Yep, kids are our future. Why aren't we putting more funding towards researching their number one disease killers? Or 4% from the National Cancer Institute is not enough, and we need more.
Yeah, we absolutely need more of just we need more people that actually want to listen, and going into these senators' offices or congressmen and women's offices. I've said before, in trying to get other people to get into the advocate space, is that, you know what, if they have children's pictures on their desks, you need to use that to your advantage. This could be you any single day. We had no idea in the world. Our daughter was diagnosed for weeks and weeks with constipation. Okay. And the child was on enough laxatives that I don't know how she was able to walk straight. And luckily, one day, and it's a blessing from whatever, that one day her eye turned inward and it was able to prompt us to have it checked out. That prompted us to a 2-week stay in Milwaukee Children's to be diagnosed with cancer, 3 brain surgeries. But what I will tell you is, on the 12th day, the child walked out of the hospital on her own, and we thought, we've beat it. We have beat this. That's the sticky thing about cancer, is that it doesn't discriminate against all of this. It definitely does what it wants to do, and you can't predict it, and you do the best you can. But childhood cancer is essentially treated by darts on a board sometimes. And it's not because the doctors don't want to help. It's because the options just aren't there. The toolbox is only so big. And that's what we're trying to fix now.
Yes, absolutely. Yeah. And as you had said, your family had never expected pediatric cancer because most of pediatric cancers are not known to be linked to any genetic syndrome. There are very few pediatric cancers that are. And so really anyone's child can be affected. And so when we think about the fact that pediatric cancers are the number one disease killers of children, we really need to be doing more. And I think we not only, from a funding standpoint and research wise and having more effective treatments and more targeted treatments, but also raising awareness and thinking of pediatric cancer sooner. I don't know, it sounded like maybe some weeks before your daughter was diagnosed, but for my son, he had been misdiagnosed for 9 months with a GI condition, despite me asking for imaging of his head. I had known as a pediatric hemonc fellow that babies who had brain tumors could present with falling off their growth curves and excessive vomiting. And that was my child. And, initially it was thought to be reflux and we'll just give him time. But it was when he fell off his growth curves between six and 7.5 months and he was vomiting mandarin oranges 10 hours after he ate them. I again brought it up. And, he had the workup of the abdominal x-ray, which didn't show any tumors in his belly. He had what's called an upper GI series to look at his anatomy to see if he had any, narrowings that could explain mandarin oranges getting stuck and him vomiting that far after oranges are supposed to be past your stomach. That he was misdiagnosed as gastroparesis, which is slow stomach emptying. I had asked the doctor caring for him at the time, can we do brain imaging? Like, I'm afraid it's a brain tumor because brain tumors in babies can present this way. And, he had said, he looks too good to have a brain tumor. He's got a clinical diagnosis of gastroparesis. We'll put him on this medication to try to increase the movement of his stomach. We'll, titrate up as needed. And, he titrated up to the maximum dose and he was still vomiting to where we were doing a load of laundry of swaddle cloths a day to clean up his vomit. And again, I kept asking, of course, this was during COVID that my son was experiencing it. So I couldn't get off work as a trainee to go to the appointments. And my husband was the one taking him to his appointments. And I was talking to this doctor through FaceTime on the phone or speakerphone and through, a messenger through a children's app where we were at the time. And only one parent could be there at appointments due to COVID. And, I just kept getting told, he's a happy spitter. He looks too good to have brain cancer. So I went on the dairy-free diet for him since I was breastfeeding. We supplemented him with a hydrolyzed, highly broken down formula, still vomiting. But at a year, supposedly they tend to grow out of it. And so we had weaned him off of that medicine. And we couldn't give our poor son a bath without him vomiting his bathwater. And again, I brought it up to his GI doctor at the time, he has since retired, and he felt, terrible once found out that I was unfortunately right, but kept bringing it up. And he's like, oh, like some kids just take a little bit longer to grow out of it. We'll do, 3 more months of this medicine before we wean. And by that point, his skull bone started to fuse. And that's when I was finally able to see the asymmetry in his face. And he developed the trouble walking, the ataxic gait, because he had a lot of fluid built up in his brain from the tumor blocking the fluid flow through his fluid components of the brain. And it was finally at that point that I was actually the fellow physician on call that weekend and reviewing charts, and I saw that my son has like, oh no, like he has a space occupying lesion in his head. It's either a brain tumor or it's an abscess. We need to go to the ER. And sure enough, when we had the CT scan, and they came in within minutes, I knew I was right. And I turned around and saw that horrid picture of that massive tumor in his head. And I just thought to myself, like, what can we do to raise awareness of these patients and how they might present, and I don't know, get buy-in and doing this workup sooner. Like my son looked great, because when you're a baby and you're developing, your body assigns those functions to the normal brain tissue. It doesn't use the abnormal brain tissue. And so, yes, he met all of his developmental milestones on time. Yes, he walked at 10 and a half months. He was running at 12 months. And so that's when I knew, when he was 16 and a half months old and he had that staggering gait and had that facial asymmetry, that, my goodness, like I was right. And, what could we have done to get his imaging sooner? I know pediatricians oftentimes don't want to do MRIs because it involves anesthesia, and anesthesia isn't great. And, saying like, oh yeah, brain cancers are rare, but maybe we can do something as far as awareness. If parents are continuing to bring up concerns about their child, like maybe we should just move forward with doing this imaging. Yes, like most of the time it's not a brain tumor, but, when symptoms are persistent, what can we do to kind of raise awareness that we should pursue the imaging? Even an ultrasound or maybe a fast brain MRI without sedation could have seen his massive tumor. So that's how I am kind of like on the mom side, straddling between like medicine and parent side. What can we do to, like, raise awareness of these symptoms for all of the medical community? And so we recognize when it's a recurrent concern that we should move forward with an evaluation so we don't have a delayed diagnosis. I had seen it many times as a fellow that, the story often was with the babies with brain tumors is that they spit up a lot. And even with my patient who had a liver cancer, the mom had brought up over and over again to the pediatrician about her concern that there was something wrong. And she expressed that the pediatrician very reluctantly got imaging. And then sure enough, so what can we do to raise funds to improve outcomes for kids diagnosed with these diseases, but also just in general, raise awareness that pediatric cancer is the #1 disease killer of children. And, there are certain signs and symptoms, and especially if they're recurrent, that we should give pediatric cancer a thought as the diagnosis. We learn in medical school about can't miss diagnoses for other things. Why not also, go down the route and thinking of pediatric cancer if the signs and symptoms could fit? I'm not saying every single child needs to be worked up for pediatric cancer, but if the symptoms can fit the bill for pediatric cancer, then we really need to think about it as people in the medical community and try to, get to the right diagnosis sooner rather than later. I don't know if it would have made any difference for my son. He's no evidence of disease right now. We just moved to every 6-month scans, but he had to have a massive brain surgery because his tumor was 9.3 centimeters and he was 16 and a half months old. So his tumor was more than a quarter of his brain volume at that time. And so I often question, had I been a meaner mom, like maybe I could have gotten him diagnosed sooner. But I also was told not to be his doctor, that I should be his mom. And so I think that was the hard part of straddling between medicine and being a mom is, being told by colleagues, and I didn't share my concerns for cancer with my pediatric hemo colleagues at the time because, again, I didn't want that label of being a hypochondriac. Just like as the medical student, when I had my brain bleeds, didn't want to overtly tell people that I was having neurologic symptoms or brain symptoms when I was on my neurology rotation because of that bias that, if you're a hypochondriac, if whatever your rotation you're on or whatever field you're in. So, but my other outside medical colleagues were just saying, be his mom, don't be his doctor. And so it was hard. I mean, I kept asking and I kept advocating and trying to get imaging done, but kept being told that he was a happy spitter and looked too good. And so I still question myself from like the mom perspective. Had I been more aggressive, would it make a difference? And I'll always question that too, like if he relapses.